As soon as the baby makes a sound, we attach to the breast and they get used to that comfort nursing, okay? How do I get my 11-month-old to stop breastfeeding so many times at night? Okay, this is a very, very common question that most mothers ask, because what happens, तपाईको बच्चाले चाहिँ रातभरि दुध खोजी हुन्छ, एकछिन 15 मिनेट 20 मिनेट आधी घण्टा भएको हुँदैन, फेरि उठेर रुन थाल्छ, they want to breastfeed. So what implication it has is that mother also does not get to sleep, हैन? त्यो रेस्ट पुग्दैन, फ्रस्ट्रेसन हुन्छ, इरिटेसन हुन्छ, मदर फ्रस्ट्रेटेड हुनु भयो भने तपाईको अटोमेटिकली मिल्क आउटपुट कम हुन्छ, ओके? सो देयर आर लट अफ इम्प्लिकेशन्स. नाउ युजुअली तपाईको 11 months of एज भनेको इट्स एन एज तपाईको बच्चाले अलरेडी सलिड खाइरहेछ एन्ड युजुअली राम्रै क्वान्टिटीमा खाइरहेको हुन्छ, हैन? अनि राति चाहिँ छिनछिनमा उठ्ने कारण के हुन्छ? युजुअली द्याट इज कल्ड कम्फर्ट नर्सिङ. भनेको जस्ट as a comfort, babies need that, you know, breast and nipples in their mouth just as a sense of comfort. So what you need to do is, like as mothers being one, I know, as mothers, like with the slightest of sound, हैन, बच्चाले अलिकति साउन्ड गर्यो कि ओहो भोको भयो भन्ने हुन्छ, हाम्रो अलार्म रिङ्स लाइक ओह बच्चा भोको भयो, ओके? सो त्यो साउन्ड आउने बित्तिकै we attach the babies to the breast. Okay, this is not the right thing to do. त्यो भयो भने this cycle will propagate. As soon as the baby makes a sound, we attach to the breast and they get used to that comfort nursing, okay? त्यो बेला चाहिँ बच्चा रोएको कारण चाहिँ भोक नहुन नि सक्छ, but as mothers our alarm rings that okay, baby is hungry, okay? So what you need to do is, when your baby makes that sound, you know, it may be for various reasons. Baby may be uncomfortable, there may be a soiled diaper, there may be, you know, just needing some comfort. So that comfort may not be the breast all the time, okay? So try to tap the baby to sleep, हैन? जस्ट हामीले यसरी थेपेर बच्चाले सुताउने कोसिस गर्ने. अब बच्चाले साउन्ड निकाल्यो, मेबी उसलाई कम्फर्ट चाहिएकै छैन, हामीले त्यतिकै कम्फर्ट दिइरहेको छौँ, हैन? सो लेट्स वेट अ व्हाइल. अब बच्चाले साउन्ड गर्यो या उठ्यो भने वी क्यान जस्ट वेट फर अ बिट, मेबी उसले आफै सुतिदिन्छ, हैन? सो आफ्टर वी वेटेड फर 2 to 3 minutes or 5 minutes, इफ द बेबी इज नट, हैन, आफैले ऊ भइरहेको छैन भने देन वी क्यान ट्याप द बेबी टु स्लिप, हैन? और वी क्यान, यु नो, hold the baby in our lap, or we can move around and try not to breastfeed every time the baby is making any movement or noise, हैन? So यदि त्यो गर्दा नि भएन भने then we come to breastfeeding, okay? So to stop this comfort nursing or whole night nursing, we have to start with these few steps, and then slowly this habit of waking every night for breastfeeding can come to a stop.
Vyasa Media Network.